One, where you may have a number of cases that you can identify surveillance. And we have explained on several occasions that a big part of our surveillance is a network across the entire country where we take samples from persons that are presenting to our health centers and to our hospitals who have absolutely no link with a confirmed case or with any travel history. This provides a network across the entire country where we're testing so that we can pick up if there are any cases that do not have these links. Now, if we are getting that we have a number of those kind of cases, then that would be also significant for community transmission. Where the third category is where we have a number of clusters that there is no link. There is no link to either any kind of imported case or that there is any confirmed case that we had identified a cluster. So there is no link to an imported case, and you have several of these clusters across the country. So that would now be the third category of transmission. Now, based on what is happening, previous to what happened at Alarico, you would have noticed that we had several clusters. I think we had, I can't recall the number offhand, but we had several clusters, but it was just very few that were not linked to an imported case. Now, what we have now with Alarica is a cluster all of itself. It's a cluster that is coming out of a workplace related transmission. And that now would be identified as one large cluster. Now, that for that cluster so far, we have not identified the link to an imported case, but the investigation is ongoing. So at the present time, we are still in the situation where it is that we have clusters of cases, and that is where we are still classified as cluster of cases. You know, I would take you to the comparison with, say, for example, China, where is still classified as cluster of cases, but there have been large numbers of persons in clusters. So there have been a large numbers of clusters, but large numbers of persons within clusters. So despite the fact that what we have in coming out of Alarica is that we have several persons, still remains one cluster. Our main aim at this time is to prevent any of those persons within this cluster to start developing their own cluster of cases and to start developing now that we would have any kind of community outbreak. And, you know, this is why the measures that we have put in place and that we are asking persons to stay at home. Stay at home. The virus is not really in a place, the virus is in a person. And so if you move and you have the virus, you're taking the virus with you. And so it is important that the same prevention and control measures for infection that you wherever you are, you maintain those. And those are to stay at home, to pay attention to hand hygiene, hand washing, to ensure that you have respiratory, you carry out respiratory etiquette to cover the cough and sneezes. All of those items still need to be in place wherever you are. It is not that a place, that the virus is in one place. You take the virus with you, and so you have to take the necessary prevention measures.
Thank you very much, CMO. We're going to go to two quick follow-ups as we bring this digital press conference to a close. We're going to go to Kate Chappell.
Yes, Minister, were you speaking generally about PPE healthcare equipment, or were you speaking just about test kits, and how many were actually blocked?
Okay, as I said earlier, the details I don't have in front of me, but I know it involved personal protective equipment, N95 masks in one instance, and also some of the what do you call them, chemicals, reagents for testing. I recall seeing correspondence that speaks specifically to those two items. As I've said before, I know that the Ministry of Foreign Affairs and Foreign Trade are working with the U.S. authorities to address the issue, and it is my hope that some issues before. So it's hopefully will be sorted out. But nevertheless, it is a fact, current scenario, and it has affected our capacity to be fully ready for these challenging times. And so when asked in the Parliament, I was being sincere about what the state of play is, even while I recognize that we will attempt to find a way around the challenges that we face.
Thank you, Minister. I go to Zara.
Okay, I have several questions, Minister. You mentioned a while ago that 12
Zara,
of the BPOs
I have a parliamentary committee meeting that is going to begin on Zoom, which I invite you to observe, on the special select committee on COVID, and it should have started already. So just give me one, please, or your top two.
Okay, the top two are the 12 you mentioned that did not meet the criteria of the inspections that were carried out between March and April for the BPOs. Was Sutherland Global one of the 12? Was Alorica one of the 12? And who are the 12? That's one question. The second question is, the BPO sector has been criticized as being, let us say, one of the places where that presents a threat to the nation. Can you articulate for me why not have the BPO sector, all the employees, work from home? I was speaking to an Alorica employee yesterday who said she had gone from working inside to now working from home. Why is it that this cannot be mandated across the sector?
Let me give you the last one, and then I don't know if Dr. Spence has information on the first question, but it is a fact that up to 10,000 of the 40,000 or so BPO workers work from home, and that's a very positive thing. And my understanding is that more are attempting to do the same, to organize for that to take place. Having spoken to a couple of the players in the sector, I'm told, however, that in some instances, clients do not want to take that decision because of the confidentiality concerns around the information or the data that has to be dealt with, because apparently there's an infrastructure that is required, taking home the computer, for example, or the laptop, access to the data in your own private space as opposed to having it in a controlled setting. And there are some concerns about that because of the confidentiality issues of the data and the risks of data going into the wrong hands. So I think that may be a key hurdle, but nevertheless, I know there are efforts to try and have more work from home, which I think is a fabulous idea and would certainly be one of the measures to maintain the social distancing in this case while continuing the industry. Dr. Spence, you have any comments on the?
Thank you, Minister. We do not have at this time the detailed inspection reports for all parishes in terms of all the entities inspected. We have a summary report. And so what has been indicated, if I may share, is that, for example, in St. James, there were 2 that did not meet the standard. And when we say not meeting this standard, while the general building and infrastructure was okay, it was in terms of, in particular for the COVID-19 circumstances, the not observing of social distancing, and in terms of the type of chemicals they would have been using for sanitization and disinfection, which would have been corrected for some of them already. And so I can't give the detail in terms of whether or not Sutherland, I think, was the BPO you mentioned, in terms of whether or not that one was found not meeting the standard. I don't have the list of the 12 that would have not met the standard just yet. I do know that Alarica in St. Catherine, however, based on inspection report received, did meet this standard at the time that it was inspected.
Thank you very much, Dr. Spence. We go to Dashan quickly.
Good morning, Minister. Just quickly, just to ask you, has any employee of the JUTC tested positive for the COVID? And I ask you that because some workers from the company have been calling and saying they've been tested positive. I spoke with the managing director yesterday on the matter, and after first denying it, when I gave him some details on the case, then he told me to contact the Ministry of Health to get any information I need on the matter. So I'm asking you.
We would have tested several persons, and we would have done contact tracing for several persons who would have gone into home contacts. Now, in terms of having the details of where those persons work and to be able to publish that, we would not be able to do that. Though we can say that the contact tracing takes us into businesses. Wherever the contact tracing takes us, we go to find the persons that are affected, and the necessary precautions and information would be given to the employers so that they would be aware of the situation. So I cannot comment directly on a worker from JUTC, but I'm going to say it's not impossible that that could have happened, because we have really contacted quite a number of persons, and we've had quite a number of positive tests.
Thank you very much, CMO, and we thank all our media colleagues for joining us. I invite our minister to give his closing remarks.
Okay, thank you very much, Stephen. Ladies and gentlemen, I want to thank you for another opportunity to speak on our COVID-19 response from the public health perspective. As you know, the government of Jamaica has kept or sought to keep the public as informed as possible around what is happening. The Honorable Prime Minister, he leads the charge, and the Cabinet in support of the best measures that we think, based on the clinical and technical advice, is for the country, given all the circumstances that we have, and the need for certain actions to be taken, including the restrictions. We will continue to do that. In the Ministry of Health, we have a briefing once, maybe twice a week, depending on the need so to do. And for the other days, we put out a daily press brief on the current status of our response to COVID-19. This again is all in the interest of being transparent, being accountable, and soliciting the support of the public as we seek to confront this and overcome this public health challenge. I want to invite those who may be interested. We're moving from here into the Special Select Committee of Parliament, which will be carried via Zoom, conducted via Zoom, and we're going to move right into that. And for those who may be interested, the meeting ID is 4189470068, and then you enter 031125. And the meeting, of course, is a discussion involving government and opposition members around the current state of the response. And I'm hoping today that we will speak on testing, among other things. And I know that there are some persons who have an interest in testing, the extent to which we're testing, the approach to testing. And it's important, I think, that we discuss and explain exactly why we're doing what we're doing and what is to come. So thank you very much. And for those who want to continue listening on, then we can go to that address for the Zoom meeting. Beyond that, we will continue to keep you updated. Thank you.